Hello, everyone. My name is Ify. I am going to be talking about wound or pressure ulcer today. Um, Pressure ulcer is one of those stuff that we as nurses has to be careful about because, especially with the geriatric population that we are taking care of. Today, I had to talk to some of my students in the clinical site, and I found out that most of them were struggling on um, staging the wound. So I'm going to do this video, and it's going to be helpful to all of you, and as many as come across this video, just to talk about pressure ulcer. So pressure ulcer is commonly found in patients that are incontinent or patients that are unable to reposition themselves, either because of age or because of an accident or whatever that may be. So when they are laying in their own urine and feces, so this can cause pressure ulcer, can cause some pressure ulcer, which is also commonly known as wound. And this pressure ulcer can be prevented. We can prevent pressure ulcer by repositioning the patient at least every 2 hours. We can also prevent pressure ulcer by cleaning the patient, especially if the patient is incontinent. We can prevent it by making sure that patient is clean and dry. Because when they sit on that feces and urine, because of the acidity of the urine, the skin begin to break down. So we need to make sure that these patients are positioned. And lucky enough, there are so many kind of mattress these days that a lot of people have invented, a lot of companies has invented that helps prevent this ulcer, or kind of help like massage the body and all that. So but still, there are a lot of people who have pressure ulcer or who do not have access to that and need to be repositioned. So we have different kinds of pressure ulcer. We have the first stage, the second stage, the third stage, and the fourth stage. And then we have one that is called unstageable. So, for the purpose of our illustration today, I have some apple that I'm going to use for this illustration. So, this is the skin. This is the skin. So, if the skin starts having a reddish or like pressure on it, and then you see those redness, like you will see in this part of the apple. So if you see this part, this in the skin, like this redness, which is very hard to see in a dark skinned person. So in a dark skinned person, it is, you kind of see like a purplish kind of color, or very dark. Um, so in a dark skinned person like me, it's kind of hard to see. You really have to look closer. But somebody who is light skinned, it's much easier. So this is the real skin. So when the stage one can be like this, when you put pressure on that skin, it becomes reddish. So we call it stage one. At this stage, the skin has not peeled, so if the skin is still intact, but it is reddish, and we can prevent it at that point in time. We can do something to make sure that it doesn't get to the second stage. So, but if nothing is done, and it will progress to this. So this, if you look here at this portion, you see when the first part of the skin is peeled, it becomes stage 2. Okay, so at this stage, it is very hard, or it can also, it is hard, but it is still also treatable, especially depending on the patient diagnosis. So for the sake of our illustration, so this is how stage two pressure ulcer will look like. The first part of the skin is peeled out, but where it is like this is stage 1, this is stage 2. Okay, so when the skin is pulled, not only that it is peeled out, but it goes down to that subcutaneous fat and tissue and all that. So it becomes stage 3. At this point, if you have like what I have in this apple now, so let me show you the stage 1, the stage 2. This is stage 2. This is stage 3. So this becomes stage 3. So, but if it goes down to the bone, to the bony ligament and tendon, with this, what we are seeing in this apple right here now is called stage 4 pressure ulcer. It is very difficult to treat, especially when the patient is diabetic or has some renal issues. Is a renal patient, end stage renal disease patients, those patients that are like in dialysis. It is very difficult to treat. So it is usually better to try to prevent this pressure ulcer before it gets to this point. So it's very difficult to treat, very painful, and except some diabetic patients don't even feel it. So we ask the nurses or the CNA to help in preventing this by turning this patient, by making sure that the medication are given at the right time for pain, or giving medication 30 minutes before any treatment, won't change treatment or anything. So, well, that is it for stages of wound today, the 4th stage. So the last one I'm going to talk about is unstageable. And this has been a very confusing thing for a lot of people, no matter how deep it is, but if it has all these necrotic tissues in the front of it, it's considered unstageable, either like a pulse and all that thing on it in the front of it. You see how this necrotic tissue, it's in front of the wound. So we call this unstageable. It is unstageable because of these necrotic tissues. So with that, we don't know how where it is, what to call it. So it is considered unstageable. So you cannot stage this because it has all these necrotic tissues around it. Okay? So this kind of wound requires debridement. The doctor comes in or the patient go to the hospital and they do what is called debridement. So the patient, this necrotic tissue, which is a dead skin, it's taken out. So they scrape it out. Oh, it's very painful. They usually like numb the patient or that area of the skin. They numb that area and they scrape it out. And when they finish scraping it out, then clean and begin to treat, because we want that granulated tissue in the front of it. So because the granulated tissue is going to help the nutrients get to the wound. Because what do we need for wound to heal? We need nutrients, we need vitamin C, we need protein, so we need oxygen. So you begin to be able to get all that blood vessels that is around there for them to begin to supply the nutrients and the oxygen that is needed for healing. So that is it for the wound today, and I hope this will help anyone that comes across it, and you guys as you prepare for your NCLEX exam or the semester exam. Thank you. And make sure you subscribe so that whenever I upload any video, and don't forget to hit the notification button. So that way, when I come on, you can come up to and be part of this, because it is live video that I do. Okay. Thank you and see you next time. Bye.